Okay, great. A great start. 3 very outstanding presentations, different systems, different experiences, but certainly some interesting overlaps. So we have 20 or 25 minutes for Q&A. So let me open it up to, first of all, forum members, and we can go to the audience as necessary. Anybody want to start? Turn your speaker on, yeah.
Yeah, thanks very much, Lonnie. Question for Jonna. You showed those viral discovery curves, and I remember at the time it's a way to predict unknown diversity of viruses. We thought it was very fascinating, and it turned out there were, in the wildlife that matter, a few 100,000 viruses, not millions, not tens of millions. So is it really, you talk about scaling up the program, is it really possible, given budgets and constraints of how much it costs to do this work, to unknown virus out there that matters?
Oh, there we go. Sorry, wrong button. Yeah, so I think let's put it in context. Okay, so if we think about how much we spend on outbreaks and pandemics, you know, the most recent one on the order of tens of billions, right? The World Bank did a study and said that we could save about $6.7 billion a year by preventing zoonotic disease outbreaks. So if we look at what it would cost us to discover just about everything that is likely to be able to spill over, it would cost on that same order or less to do that. So we're talking about saving what we could save in 1 year. We could spend over, we couldn't do it in 1 year, but we could spend it over probably about 10 years on the order of, it's much less than 10 billion, but over $1 billion to discover all the viruses out there that are likely to spill over to people. And then once we discover them, we have some work to do. We have to prioritize them, characterize them, but that gives us the opportunity to have targets, to be prepared, to change behavior. Primarily, probably will reduce our cost the most, but also for those really risky ones, develop countermeasures, vaccines, treatments, those kinds of things. And wouldn't it be lovely to move to a place where we're actually able to come up with vaccines and diagnostics and really treatments that are not specific to every single virus that's coming out. I think that's where we really need to move, is to get ahead of that and have broader treatments and vaccinations as well.
Thanks for those 3 fascinating talks. So I'm a public health person, and I'm curious to get your, I'm Jeff Duchin, forum member, Public Health, Seattle King County, and University of Washington, Seattle. My question is about where's the boundary between research and product that you've described this morning. It's a little blurry for me. Some of what you described seems to be research, but I get the feeling that there's also something that seems to be potentially useful to governments and public health agencies, and I'm wondering where you feel like you are in that continuum. And in the context of useful product, I'm wondering, how do you measure, characterize, and communicate uncertainty in your work to the end users?
So why don't you all have anything?
Sure, I think we are in a research phase, but as we're going, we are providing product. So as I mentioned, we've responded to more than 23 outbreaks in the first 5 years. So straight away, we're using the data to help inform strategies to prevent spread, amplification and spread. Where we really want to be is prevent spillover. But that's going to take decades. So if you're asking us what we're doing now useful, I think it's useful. We are being called upon to help in emergencies and even in prevention strategies now. But where we want to be is decades, probably at least 1 decade away.
If I could take that up with relation to Zika and perhaps just give you a few examples about how those maps are actually used. So I guess because of my accent and where I came from, many of my networks in this area are still the UK government. So those maps have been used to look at the advice that we give through our Foreign and Commonwealth Office through travel advisories. I mean, they're not the only thing that goes into that, but they're definitely being looked into. They have also been supplied to the Department for International Development, who is looking at the risks and where to do seroprevalence surveys for Zika in many of the Commonwealth countries that are of interest. And that's how some of these maps are used very, very quickly. And then other people are looking at those maps to say, if there's risk in certain areas, where are people moving to and from, what's the volume of flights from risk areas in Brazil to the US over the summer, for example. So those are sort of different constituents for the maps. Uncertainty, massive thing for us, and I didn't talk about it at all, which I apologize for, but we spend perhaps 50% of our research time trying to work out how to get the uncertainty envelopes correct for much of the mapping that we do. And we still, I don't think, have cracked the problem about how to communicate that uncertainty properly to all of our different constituents, because most people just use the central tendency map, and although you provide all of that richer detail about the uncertainty, which is vast in some places, and we try and acknowledge that, it's very, very rarely used. So there's a rich area for exploration and discovery there.
I think I would very much echo the importance of uncertainty. I think uncertainty often prevents overreaction from a result or a change in some underlying quantity that you're providing to a program. When we calculate measures of risk, we also provide uncertainty bounds on that. So if you're trying to identify differences over time, seeing if those differences are meaningful or greater than your uncertainty is a key part to determine whether or not you need to change anything into the underlying actions or recommendations that you're making. So I think it's also sometimes difficult to convey uncertainty because it can overload a figure or create a whole discussion around it, but we also think it's very important to communicate at the same time.
Rima?
Good morning, Rima Kawaz, CDC. So thank you for outstanding presentations, and it's quite exciting to see the promise opportunities of big data. I come obviously from the same bias as Jeff in terms of public health on the ground doing the work, and I think you all said it well, that this is the big data can complement and add on. It's not like we're going to do away with needing surveillance systems and shoe leather investigations in places, but it's pretty exciting to see the opportunities. And Dr. Hay, again, going back to EBRAID, I was excited about the maps and maps that can get you to predict, but just to challenge us a little bit, I'm looking at the US and your map on Zika, and so the red is the south and southeast. So if you look at the Aedes mosquito distribution and what we know about dengue coming in and taking local, that's the same area. So, I would say, at least in that region, what is it adding? It's nice, it's nifty, it's great to see, but again, maybe you can help me out.
To clarify exactly what that map is, it's a map of the environmental suitability in that location. So we know, and you have a history in the US over the last 20 to 25 years of multiple introductions of chikungunya and dengue, and they don't spark. Very different to just over the border, but the innate risk, i.e. the suitability of that environment is very good there. So you have to layer something on top of that to look at that exposure. However, if I had your job, it is those parts of the US I would be very, very concerned at looking at in this coming summer, rather than the other wider parts of the US, and we can put lines on where you would prioritize that extra vigilance perhaps this summer. So I wouldn't be worried about where I live in Seattle, for example. And within that region, that would be the area that I would be particularly concerned about, just sensitizing people to the fact that you could have these outbreaks. We might have to deploy teams. Travelers coming back from Brazil in those particular areas are probably more worth your time worrying about than people in other. So it's that kind of information. We're not, those red areas on the map, and this is well caveated in that paper, not in my talk, for which I apologize, but they are not saying that that's going to be, you know, widespread Zika in the US.
Thank you. Can I ask her? So I also like the modeling that focuses operational efforts related to, this is Dr. Chabot-Couture, the polio eradication. I think it's pretty exciting, and the maps that you show of Pakistan were very, very interesting. Again, I think it adds on to the work on the ground where you have teams going in and, you know, a degree of granularity, so that's great. Now, I'm struggling with the tweet mapping. You know, things go viral on tweet, and, you know, we see how things, you know, it looks nice, get retweeted, and, you know, I tweet, but I'm not sure how reflective tweet can be of occurrences. So, any thoughts?
So it's an opportunity. It hasn't been tested, and I still think in the if we were to throw away 99.9% of tweets every day, and we just found that 0.01% that had a useful bit of occurrence data in it, in one day we would have more dengue occurrence data, we would have more disease data on a specific disease than we were able to get from these more formal. So I'm not saying it will ever replace, I am making the assumption, and I did say in that slide it is an assumption that I'd like to test, that in some of these sources, and not Twitter was the exemplar, but maybe from Google searches and others, that there would be high provenance disease information that we could extract from that vast sum of data. I'm not saying it will ever become the forefront of disease surveillance, but it could be a very nice adjunct in a sort of a data fusion type method, and it's certainly something that I would like to explore.
Well, I certainly enjoyed hearing all of this, and I'm glad to see. I always like maps. That's personal opinion. Also, the bureaucracy likes maps, because maps are understandable. Whereas if you tell the people running countries, here's some data, they often don't really grasp that, including this one. So I think that I heard a lot. What I was a little disappointed in is I heard all of the problems, which have always been there. This is not new. We could have had this conference 2 years ago, and the same problems would have been there, validity, all that. I did not hear, unless I missed it, anything dramatically new technologically that might move us from what I like to call hunter-gatherers to people growing the crops. And I think that hopefully, as the day and a half progresses, we'll hear more about what is novel that's going to change the gathering. Because I gather, you know, terabytes of data, but, you know, how am I going to use it? What's new out there? Even if you look at cancer, you say somebody's got lymphoma, and you feed that into Watson, and you know, Watson will know his renal function, his liver function, all that stuff, and can come up with a regimen. But those are really pretty structured data. And here we seem to deal with a lot of unstructured. So I'm looking forward to more talks on how are we going to change the way we use the data.
So maybe a futuristic look from all three of you in terms of kind of where you are, your experiences, and projecting in the next decade. What kind of breakthroughs do you really see that are kind of innovative strategies that you might talk about? Did that change your answer?
Well, from my perspective, well, first of all, thanks about the maps because you validated me. I always tell my students, if you want to get a good publication, put a map in it, even if it doesn't need a map. So that's true. But I think it's not sexy, so it doesn't sound novel. But it is novel if you look at the data, and I think it would improve what these gentlemen do immensely. We need to collect the data and agree as a global community on some standard fields. So if we could agree to take geo-reference data and to the number of decimal points we want to take the lat long, that would be incredibly novel. Right now, these folks, including me, have to often just look at the country of the person submitting the data, and it doesn't even mean that's where the data were collected. So we need to agree as a global community on some standard things that we want to know. With the PREDICT project, we're collecting huge amounts of data on every sample. We get event data, what's happening with the weather, what's happening with human and animal migration around every single sample we take. We take site information around every single sample we take. How many cows are here? What's happening? How many goats are here? Are there rodents? Are there bats? Are there birds? We take that even though we're taking a mouse sample, okay? So we're collecting all that information. I don't expect that that's the level of information that the rest of the world will want to collect on every single thing. But if we don't get down to some basic data collection standards that we can agree to, we can't make those amazing maps that are of high quality to get where we want to go, which is really forecasting.
I think it's a very interesting question to ask, where might we be in 5 or 10 years when it comes to kind of big data and digital epidemiology. And it's often very sobering if you're trained in analytics and you expect maybe mobile phone collecting data sets or databases. When you actually see the reality on the ground, you realize there's still a lot of paper-based forms out there. There's still a lot of aggregation that happens that I think shows the opportunity. If you're still collecting paper-based forms, or if you're still doing very traditional data collection, that means you can go all the way to mobile phone data collection, GPS coordinates for your data points, more richer surveys, more rapid data transmission directly from the field, not having to go from your district office, your provincial office, to your federal office, to the one person who does Excel models in that area. So I think the evolution of the way data is collected, aggregated, and maintained is going to provide the opportunities that we already kind of take for granted. The Amazon, the Google, they already have good data system, and I think that's what's going to eventually take place when it comes to more epidemiology or disease surveillance. You're going to have these tools available to you. There's a number of projects that are very interesting. For example, in Nigeria, for polio eradication, they gave more than 10,000 vaccination teams a mobile phone and tracked them during the entire day of the vaccination for multiple days in a row for vaccination campaigns for over a year. And what they were able to find from that, which is a very large amount of data, is those small villages that don't get vaccinated, right? That would not appear on a map, or you'd have no idea about. Maybe that village doesn't even have a name. And they were discovering these places that hadn't been vaccinated and finding ways to vaccinate them. So I think that's a beautiful example of how new technology is making its way into global health. But I think we're still at the beginning. So if we think about what the state of the art from our experience every day is, it's very high, and what's actually being used, it's just beginning to happen. So I think there's a lot of prospects in that area, either for machine learning or for data collection, more rich data that are yet to be realized.
Yeah, I'd like to come back to both of your points there. So, one in relation to hunter-gathering, that still is So I tried to articulate the problem that we face there and the landscape of geographical opportunity, if you like, in this area. Perhaps it's not news to say that maybe myself as a researcher in a small team in an academic institution might not be the best person to take forward launching this into a software environment that could take on the machine learning and grab this and really take it to the next level. So it'd be interesting to explore, once a prototype's been set up, how you manage to sort of ignite that to a stage where it would take off. And it's not an area that I profess to have any kind of expertise in. The other thing that I would like to mention just briefly is that there's a whole basis of mapping that we do that is tied on very much stronger epi evidence that people collect routinely through massive health surveys and routine health statistics, and the things that we do for malaria in a much finer spatial resolution in space and time. Now, people tend to collect these information much more routinely than they do for many of the other diseases which we use for the occurrence mapping. And in that domain, I think that there is a massive potential for us to use these more advanced geospatial techniques to look at inequities and populations that we're missing, and to combine that with the very much boots on the ground traditional epi and the sort of, not so much the hunter-gathering, but the kind of standard interaction with countries and populations, and perhaps direct that work a little bit more efficiently in the future. That's what I would, that confluence of both of those is where I think we could make some massive gains, efficiency gains.
So we're getting close to the end of this session, but is there a final question maybe from the audience? Martin, I'll get one. Why don't you go ahead?
Thank you. Martin Sepulveda, recently retired senior executive physician at the IBM company in the Watson Research Laboratory and National Academy of Medicine. And I want to try to add to what Simon and Guillaume shared on the question that was asked. I think some of the things that are new are the technologies that are underneath artificial intelligence. And we have someone on our panel this afternoon who will be able to talk a lot more and much more competently about it than I. But simply the ability, through the advancement of the technology of natural language processing, allows for the massive ability to be able to go out into the world's corpus of knowledge measured in seconds, and to be able to apply this technology to identify and harvest information from highly nuanced inquiries is new. It's new, it's active, it's in its early phases, and it's proving to be a highly valuable technology. So when Simon said it took us a year, to do this stuff, and we spent an enormous amount of time just going out there to find and identify and process and quantify and qualify the information, these technologies, they can do that really rapidly.
Final question.
My name is Stephen Alt. This is a question for Dr. Jonah Mazet. Your project strikes me as one which would offer a great opportunity for capacity building, particularly in the countries in which you worked. And you certainly have noted that you were sharing information with ministries of health, agriculture, and environment. What sort of capacity building have you done, or can you see being done working with schools of veterinary medicine, human medicine, animal health technician training programs, et cetera, with respect to your work?
Yeah, thank you. So in the first 5 years, we were able to train 2,500 individuals in the countries where we were working to do the kind of surveillance and laboratory work that I mentioned. In different countries, we headquarter our operations out of different universities and/or ministries. More universities than ministries, but sometimes directly in the ministry labs as well. In Predict 2, we've now moved into having the human and the animal health. So we have 2 laboratories. In fact, in the first 5 years, we targeted 32 laboratories in the country, in the 20 countries, and we were able to get 28 up and running and doing the viral level PCR. And so in those countries where they maybe didn't have a PCR machine, they were then able to detect and discover new virus. So the capacity to have in every country at least one lab that could diagnose a mystery viral illness is incredibly important to me. That's a soapbox. I think if I were to measure myself on whether we were successful, it's not on how many viruses we found or discovered, if you will. They don't think they're discovered. They're not new themselves. But it's that the countries were doing that work themselves. So that's the most proud. Now, we do have a sister project also funded by USAID called the One Health Workforce. And the One Health Workforce project is totally centered around the schools of public health and veterinary medicine and putting curricula in place to train the next generation of One Health professionals. And we help contribute to that curricula and sometimes teach with them. But that's led by the University of Minnesota and Tufts on the U.S. side.
Okay, so a great start. My Fitbit technology says I've had more calories than I've burned, so we're going to take 15 minutes to correct that. And so please join me in thanking our panel this morning.